Welcome back. If you or someone you know is suffering from numbness and tingling in your toes, feet, or hands, maybe it's a burning pain or loss of sensation, you may have what's called peripheral neuropathy. Joining us this morning to tell us all about it and a brand new technology that's going to help eliminate it is Dr. Ashley Herfindahl with San Diego Neck and Back Pain Relief Center. Thanks for being with us again.
Nice to see you, Greg.
All right, first of all, tell us, what is peripheral neuropathy?
Well, peripheral neuropathy involves either the hands or the feet. Usually, as far as for peripheral neuropathy, just like you kind of mentioned, it could be numbness and tingling in your hands or feet. And usually encompasses almost like the whole entire hand. And just like a glove, they call it kind of a glove and stocking, or stocking would be the whole entire foot, the toes, the calf. And what people will experience is numbness and tingling, burning pain. They'll have, as far as weakness in the muscles, they'll have decrease in reflexes.
And loss of sensation, they may not even
really they may not feel it. Like, I mean, an example would be, for example, someone getting into their tub or shower, and they can't tell the difference between hot or cold, so that can cause some major problems.
Is that an advanced stage of neuropathy?
It is. It can be an advanced stage of neuropathy, or just like the loss of feeling. You know, you're not able to, like, oh, is this cold? Is this hot? You know, in regards to that.
Who typically has it?
Well, typically it's usually in older people, and it's usually women, predominantly women, but men can have it as well. Also, people that actually can cause peripheral neuropathy, well, the number one is usually diabetes. So and it can be at a later stage. You kind of hear sometimes where diabetic neuropathy, that's like a big key word. And other people can actually have, as far as neuropathy would be cancer patients, someone who undergone chemotherapy. Someone who had shingles can actually have that. Someone actually had like spinal surgery, fractures, hip replacements, knee replacements. And there's a variety of other different kinds of things that actually can cause peripheral neuropathy. Other one is as far as statin drugs can actually cause peripheral neuropathy. So
if you're older and you're taking some medication, and does it typically affect older people? It's typically affecting older people because it's a more progressive type of problem. And like I said, when people have surgeries, you know, it's typically not the young. So I typically won't see someone, for example, in their 20s to have peripheral neuropathy. And a lot of these people will have it for 10 to 15 years. Okay, so talk about the treatment. Talk about what you offer.
Sure. Well, what we do is we use, as far as infrared light therapy, that's one of the type of treatments. As you can see here, we use a health light, and I'll just turn it on so you can actually see it. And we'll just turn it on. You can actually see this. So this is actually, it's actually a boot. And you can kind of see here we have infrared and we have red light. And actually it kind of goes just like this. And we kind of wrap this around. This is a strap. It goes right around this as far as the foot. We have another pad that you can kind of see as far as right here. And we'll actually put that on a patient. Now the one thing about this, which is great, is, well, number one is there is no other treatment for peripheral neuropathy. There's nothing out there. A lot of these patients, like I said, suffer 10, 15 years. And they just haven't been able to help. Now what this does is we actually wrap this list. For example, the most common is the feet, more so than the hands. Now the hands will get it. Well, circulation issues. And you're actually walking around, standing all the time. And it takes a lot longer for the feet to heal. And also too, when we actually, even our treatment, and kind of jumping ahead, is we'll actually get patients to be sitting as far as in a zero gravity chair, takes the pressure off as far as the feet. Also, a lot of these cases, these patients can have cramping. As far as in their hands, or as far as their feet. Now, what we're doing is we're actually stimulating the nerve. We want the nerve to heal because these people have desensitization in their feet or their hands.
And that's what the infrared does.
And that's what it does. We're stimulating the nerve. Also, what we're actually doing is we're increasing as far as circulation and allowing his patients for more function. The one key thing is as the disease with neuropathy gets progressively worse, these people can't stand up or walk for that matter, and they can lose their balance and fall. And this is where he kind of leads into, for example, the patients falling, older patients, hip fracture. So it's not taken care of, they can fall. That's why you always hear of older people breaking their hip. And then in terms of treatment, what we actually do with peripheral neuropathy, we do is as far as the light therapy, we also will adjust their feet. I'll actually, as far as adjust their feet, get some motion going on, or their hand.
So manipulate the feet and then use the infrared.
Use the infrared.
So there's the treatment at the office, and then you have a home treatment plan as well. Now,
True.
I want to get to the offer because you have a great offer today, only for San Diego Living viewers.
That's correct.
Talk about that.
Well, what we're doing is we're going to do the full evaluation. We'll do some nerve tests on someone. I'll do a specific type of test. It's geared to peripheral neuropathy, whether or not I'm able to grade it out of a 72-point question. See whether or not they have this. We'll do some orthopedic neurological evaluation. We'll even, if we need to take x-rays, because the real key, we want to see whether or not the if it's peripheral neuropathy just in their feet or their hands, or is it coming from the nervous system and the spine.
And you've had some great results from this. Oh, for only $39, we should say. I mean, it's less than a night out at a dinner for two.
Sure, that's right. Well, the goal is I want to help people, and that's why we do this promotion. It's not I want to help people, and like I said, a lot of these patients, there's nothing out there. They haven't had a successful anything. They've had it 10 to 15 years. It can lead to a lot more progressive problems. With diabetic patients, it can get to the point they have to do amputation.
All right, Dr. Ashley Herfindahl, thank you very much.
Well, thanks,
some great
Greg.
information.
Thanks for being here.
All right, and of course, for more information, if you missed it, you can go to our website, sandiego6.com. Well, Ruben is out at the Melting Pot in La Jolla, and buddy, I was going to be out there tonight.